we talked about how your lower back needs to be trained just like everything else. Normally when people do lower back training, all they do is like a typical cat-cow where they round up all the way, come into flexion, right? We find full flexion here and then go into full extension. That's like a typically done cat-cow, or as we would normally do, spine segmentation. If we want to bias just the lower part of your spine, your lumbar spine, we're going to put you in a modified cat-cow to give bias to just that. So what that's going to look like is you're going to go and put your forehead on the table, more like the top of your head, like that. And then what I want you to do is put both of your hands like this. To start, I want you to find flexion in your thoracic spine and your lumbar spine. Yes, keep rounding this up into me too. See if you can breathe into it. You're gonna get a bit of scapula protraction here as well. So the idea is that we're doing a modified quadruped cat-cow to bias the anterior posterior pelvic tilt along with the lumbar spine segmentation. So if we find full flexion again, I want you to take a really big, deep, satisfying breath and then just try to find a little bit more flexion. And as you find the end range of motion of lumbar flexion, I want you to feel the association of your abdomen kind of tightening and how that's shooting your spine up towards the roof. And I also want you to feel the contributions of like your glutes, your hamstrings sort of, to initiate that posterior pelvic tilt where you're kind of tucking your tail under you. Now, if we want to do segmentation for the lumbar spine, without moving your thoracic spine, I don't want to see any movement out of this curvature. I want you to begin anteriorly tilting your pelvis really slowly and see if you can break your pelvis separate from the spine. And then from there, you're gonna work into lumbar extension. And then when we get to like your TL junction, where the lumbar spine kind of meets the thoracic spine, that's where you're gonna stop and then reset back into flexion. So go ahead and find full flexion all the way up, push up into my hand, and then without moving, begin initiating anterior pelvic tilt. So you're sticking your butt up. You're trying to feel maybe like upper glutes initiating movement here. Without moving any of the thoracic spine, we're just doing lumbar biased segmentation. And then when you feel like you're getting up into your TL junction, pause. Let's go back up into flexion and see if you can restart again, but without moving at the thoracic spine so much. So right now we came out of thoracic flexion. So restart again, come all the way up into flexion for me. Exactly. And then from here, reinitiate thoracic flexion. I'm trying to get you to break your lumbar spine apart from your thoracic spine. So you might not have as much range of motion as you actually think. So again, try to find a little bit more flexion, that right there, almost some scap protraction as well. Don't move this at all. And again, begin initiating anterior pelvic tilt and just see if you can laser in on this subsection of your spine as opposed to where I have my hand with contact on you. Exactly. So now pause. Can you get a little bit deeper into this without breaking from here? Exactly. Now can you break this back into flexion? Yes, without breaking this. Now find more extension. Can you do that? Exactly. Now maintain both and take a really big deep breath there and see if you can get a little bit more extension out of your lumbar spine as you take a really big deep breath. Exactly, and then reinitiate thoracic flexion. Now what I want you to do is keep this still and initiate from the bottom. So now go into posterior pelvic tilt. And as you go into posterior pelvic tilt, you'll be looking for glutes and hamstrings to initiate the pelvic rotation. And then you're actually flexing at the lowest point of your lumbar spine, and you're working up into like L3, L2, L1, into your TL junction, and then you're reinitiating into thoracic flexion. One more time, take a really big deep breath and find global flexion. I want to see everything just kind of rounded up here. I want you to feel the abdomen tightening to get you into flexion. Take another big deep breath and try to give me a little bit more thoracic here. Think about your scapula opening up too. You did a little bit better earlier with that. Can you push up into me here? Yes, that right there. Now one more time, without losing me here, I want you to begin anterior pelvic tilt from the bottom. Exactly. You're doing a much better job not moving at the thoracic spine. So again, this is just a movement exploration practice. We're trying to break the lumbar spine apart from the thoracic spine, and we have you in a modified quadruped so that you can kind of explore that range. To finish off, try to recorrect this. You came out of flexion up here. You got a little bit more there? Yes. Good job there. Find more extension in the lumbar spine. and just kind of take a big deep breath to relax into that and show your body what this feels like. Take like a screenshot in your head and contract the lumbar extensors a little bit further. See if you can tilt your pelvis a little bit more. And then one last time, recreate that curvature here. Exactly. Does that kind of make sense? How we can break apart the lumbar spine in a modified quadruped. Yeah? Awesome. So we can use sit-ups to train our lumbar spine, which it's not usually viewed that way, right? It's normally looked as an ab exercise, but we're using the sit-up to train the front of our spine, our lower abdomen. When people do sit-ups, they typically just kind of like task train it, where they're leaning back and then they're sitting up mindlessly. And you'll often hear people say they feel their hip flexors. And that's because they're pulling through their hips as opposed to pulling through their spine. It's a spine flexion exercise. And so what you're gonna do is what we call segmented sit-ups. And as you come down, I want you thinking spine segmentation like we did in the cat-cow, in the quadruped. So you're gonna push your lower spine down one by one. And as you come down, you're using your abdomen to flatten onto the bench. You can come back and initiate extension. Restart the rep by initiating flexion, tuck the chin, and you're curving the spine to create as much flexion as you can, as opposed to just mindlessly sitting up and using your hip flexors to do that. If this is too hard, we can obviously raise the incline. And if it's too easy, we can make the decline steeper, so that's a little bit more challenging on your abs to flex the spine. I want you starting in the top position, and I'm gonna put my hand on your lower back so that it's kind of like tactile feedback for you to initiate flexion. So as you come down, the only thing I actually care about is this touching the bench first. So go ahead and begin doing the eccentric. Take your time and push your lower spine down into my hand. A little bit more. Yes, more intentional. Exactly. And the idea is that you are doing segmentation. One vertebrae at a time is kind of landing on the bench, and you should be feeling your abdomen here contributing to the flexion down onto the bench. Keep going until you're basically breaking my hand. Exactly. Exactly. And don't lose the lower abs. And you're going to come all the way back. You're allowed to initiate extension, so you can kind of just feel the other end of the spectrum. If you were to restart the rep, you're gonna start by driving flexion, press down into my hand here, and then from there, tuck the chin, think about rounding the cervical spine, and then I'm peeling you up one by one, but keep pushing down on my hand like you're breaking my hand. And imagine my hand's a spatula, one vertebrae at a time is grinding off the bench. You're trying to create as much curvature in the global spine as possible, especially the lumbar spine, and the abdomen's what's doing all the work there. I want you to give me 3 more reps and see if you can do a little bit more intentional with the lower lumbar spine hitting the bench first. So you're just trying to get the deepest core engagement that you can. Push down. Yes, that was much better. And so again, my hand is just here as tactile feedback. Can you push down any more? Yes. Think about posterior pelvic tilt too. Think about kind of like tucking your tail under you. The lower abs are driving down. If my hand is here on your lower spine, push down on my hand. Push down on my hand. Exactly. Keep going. Don't lose me. And then you're in extension. You might feel the abdomen stretching. Again, think about breaking my hand with your lower back. Right through here. Yes. Tuck the chin to the sternum. You're rounding through the cervical spine. You're rounding the thoracic spine, again, slowly, one by one. You're segmenting all the way up off the bench. Keep creating curvature. Keep creating curvature. Keep going. Keep going. Beautiful. You got 2 more reps. If it starts getting too hard on the concentric, then you're free to just like kind of cheat your way up and then just do the eccentric component of the rep as well. There's not one way to do this. Let's get 2 more reps here and then we'll move on and do a extension-based exercise. So start pushing down. More intentional, pause, pause, pause. Drive more from here. Yes, drive more from here. Find the lower abs down where your belly button is. You can do a little bit better with that. Keep going, more here, more here. I wanna see more lumbar flexion, man. Come on, find your lower, that right there. Give me more, give me more, give me more, give me more. Good, keep going, awesome. Again, initiate through flexion of the lower back. Crush my hand here. Now tuck the chin to the sternum. You're rounding through the cervical spine. You're rounding through the thoracic spine. You're trying to break my hand on the lower back. And again, peeling up. Create curvature, create curvature, create curvature. You can kind of throw yourself back up. Give me 1 more rep there. and then we can move on. Again, one last rep here. Breaking my hand. The first vertebrae to hit the bench should be your tailbone. I want to see the sacrum hitting first. More lower ab engagement. You can do better with that. More intentional. More intentional. All the way down, and then back up. You found extension. Reinitiate flexion. Push the lower back down. Tighten the abdomen. All this anterior spine tissue. Tuck the chin. Best one yet. Create curvature. Create curvature, and you're failing. Just throw it up. So again, a sit-up's normally just viewed as like an ab exercise, but you're using the lower abdomen, which is really what initiates lumbar flexion. And so having that in mind kind of allows for you to train the lumbar spine a little bit better, as well as finding a little bit deeper core engagement to make the exercise more productive. Yeah? Let's go do extension. So we're looking to train extension of your spine next. Oftentimes, people will train extension through something like this. The problem with this setup is you get a lot of hip extension as well as, say, thoracic extension, depending on how well your lumbar spine actually works. We're gonna work on lumbar bias segmentation through an EQI. You're gonna do an eccentric quasi-isometric, basically just holding the end range of flexion, and we're gonna use a GHD like this to create a setup where you're holding on here. You're gonna tuck your legs. You can tuck your feet like this, I don't really care. Well, all you're gonna do is use your lumbar extensors to kind of pull yourself up. So right now, the only thing that's firing is extension in the lumbar spine. I'm not getting any hip extension like I did before this, and I'm not getting any thoracic extension. So I'm able to funnel all of the tension into just the lumbar spine specifically, and all you're gonna do is hold that end range of motion for an extended period of time just to create as much tension as you can. So let's get you folded over here. Depending on the length of your arms, I have the setting pretty far because you have a long wingspan. If someone was shorter, obviously we can move this forward. In a perfect world, we would do this on a reverse hyper machine. We're using a GHD as like kind of a makeshift setup for it. So let's have you fold over here. You have the freedom to grab from here or up here, but it typically is better. You can tuck your feet however you see fit. What I'm looking for next is to extend from just your lumbar spine. So pull your feet up with your lower back erectors. So right now, do you feel your lower spine shortening right now? So all we're doing here is holding an isometric contraction in the shortened position. And right now, your lower half of your body, your hips, your pelvis, your legs, is the loading mechanism, right? The weight of your legs is what's pulling on the lumbar spine. And right now, gravity is pulling your feet down, which makes your spine want to go into flexion. And that's now forcing you to shorten all of your extensors to pull yourself into anterior pelvic tilt. Right now, again, drive more anterior pelvic tilt, give me more lumbar extension. Pull up your butt even more. Use your lumbar spine. That right there. See if you can shorten that a little bit further. I have you on a timer right now. You're at 30 seconds. You're gonna go for additional 30 seconds, and then I'm gonna let you give me repetitions where you're moving out of extension and into flexion, and then you're gonna move back up into extension. So try to drive a little bit more extension here. If you can recruit even your upper lumbar spine, like your L1, your L2, think about even more anterior pelvic tilt there. You got another 10, 9, 8, 7, don't lose me, come on. 6, 5, 4, 3, 2, 1. Now relax, but don't let go. I want you now to let your lumbar spine go into flexion. So you're kind of letting your pelvis kind of wrap back around the pad here. And you can feel this tissue now go into length a little bit more, right? Initiate extension again and make your lumbar spine pull your legs up off the floor again. So you're initiating anterior pelvic tilt. You're using your lumbar spine to pull yourself up even more. And again, we should feel the erectors going into full extension in the shortened position. Is that right? Yeah. Hold that again. You have another 45 seconds of maintaining this isometric contraction. So again, the training stimulus is simply just holding this shortened position for as long as you can. And you probably feel your spine wanting to go into flexion, but you're supposed to keep fighting that eccentric. So again, try to find even more lumbar extension. You have another 10 seconds. I don't want so much movement from the feet. I want more movement from here. Yes, exactly. You found a little bit more lumbar spine there. Good. You got another 20 seconds there. I want you just to maintain that contraction. Breathe your way through it. You got another 10, 9, 8, 7. Don't lose that. Find more. 6, exactly. 5, 4, 3, 2, and 1. You can relax out of that. And so again, for that, all you did was train the lower spine when it was fully short. And before this, with the sit-ups, we trained the front of your spine in the shortened position, right, through the segments and sit-ups. So this kind of contrasted it and kind of trained your spine on the other end of the spectrum. And I bet you can imagine if you did this the way I had initially, where I had my feet here with my head facing this way, you'd end up getting a lot of glutes, right? You'd be fully extending your hips as opposed to extending the spine. And that setup we did allowed for you to drive all the tension from here as opposed to the lower half of the body or as opposed to the thoracic spine. Does that make sense? Yeah? That was good. That was hard.
That's really good.
Thank you so much for watching the Bodybuilding Not Body Breaking YouTube channel. If you found it helpful, drop a comment, like, subscribe, share it with a friend or family. That stuff really helps us in expanding our reach to popularizing this training approach because we know there just isn't a better way to do things. If you have interest in diving deeper into the stuff you just watched, feel free to join our school community. On our school community, we have a lot of additional content. We have an exercise library that has over 200 different movement options. We have programs. We have additional videos that are concepts, lectures, and rants to give you guys a deeper understanding as to how and why we do things. We also have a discussion board where you can get direct access to coaching feedback from me personally. You can also follow us on Instagram, Facebook, and TikTok for additional updates for when we post new content. Thank you again for watching, and we hope it was of use to you.